Hello everyone and welcome back to the channel. Today we are talking about neuropathy, a condition that affects the peripheral nerves and commonly causes symptoms such as pain, burning, tingling, numbness, pins and needle sensations, or weakness, most often in the hands and feet. And while many people automatically associate neuropathy only with diabetes, the reality is that neuropathy can develop or worsen due to many other factors, including medications and environmental toxins that people may be exposed to without even realizing it, which is why this discussion is so important. And before we begin, it is important to clearly state that this video is for educational purposes only and is not intended to replace professional medical advice, diagnosis, or treatment. And any concerns about symptoms or medications should always be discussed with a qualified healthcare provider. Neuropathy simply means damage or dysfunction of the peripheral nerves, which are the nerves outside of the brain and spinal cord, and these nerves are responsible for sensation, movement, and many automatic body functions. So when they are damaged, the symptoms can significantly affect quality of life. And although diabetes is one of the most common causes of neuropathy worldwide, many people without diabetes also experience neuropathy. And even among people with well-controlled diabetes, neuropathy may continue to worsen, remain unexplained, or fail to improve. And in many of these cases, the condition is labeled as idiopathic, meaning no known cause. But in reality, there is often an underlying contributor that has simply not been identified or fully explored, such as long-term exposure to certain medications or toxins. Many patients express frustration by saying their blood sugar levels are under good control, yet their nerve pain continues or even progresses. And one possible explanation is ongoing exposure to substances that negatively affect nerve health, including prescription drugs that are necessary for treating other conditions, and environmental or occupational toxins that may accumulate over time. And even when diabetes is present, these additional factors can significantly worsen nerve damage or slow down nerve recovery. Drug-induced neuropathy is an important and often overlooked cause of nerve damage, especially because many people today take multiple medications for chronic conditions, sometimes 10 or more. And while these medications are often necessary and even life-saving, some of them are known to interfere with nerve function when used long-term or at higher doses. And this does not mean that these drugs are bad or should never be used, but rather that awareness and monitoring are essential. Certain chemotherapy drugs are well known to cause peripheral neuropathy as a side effect because they affect rapidly dividing cells and can damage nerve fibers in the process. And while these treatments are critical for cancer survival, nerve symptoms may appear during or after treatment and sometimes persist long-term. Some medications used to control abnormal heart rhythms have also been associated with nerve symptoms in certain individuals, especially with prolonged use. Long-term or repeated use of certain antibiotics has been linked to neuropathy, particularly when treatment courses are extended or doses are high, and while antibiotics save lives, unnecessary or prolonged use can carry risks. Treatments used for HIV can also contribute to neuropathy, although the virus itself can damage nerves as well, making it challenging to determine the exact cause in some cases. Anti-seizure medications, which help stabilize abnormal electrical activity in the brain, may affect nerve signaling in some people. And tuberculosis medications are another known category that can interfere with nerve metabolism, especially if nutritional deficiencies are present at the same time. Medications used to treat autoimmune and inflammatory conditions such as rheumatoid arthritis can rarely be associated with nerve symptoms, and cholesterol-lowering drugs, commonly known as statins, are widely prescribed and very effective. But in some individuals, they have been linked not only to muscle symptoms but also to nerve-related complaints. Vitamin B6, also known as pyridoxine, deserves special attention because both deficiency and excess can cause neuropathy, meaning that taking high doses of vitamin B6 supplements without medical guidance may actually worsen nerve symptoms rather than help them, which is why balance and proper dosing are crucial. It is extremely important to emphasize that no one should ever stop or change a prescribed medication without consulting their doctor. But if nerve symptoms develop, it is reasonable to discuss possible side effects, alternative treatments, or monitoring strategies with a healthcare professional. In addition to medications, toxins play a significant role in nerve damage, and many people are exposed to potentially harmful substances through their environment, occupation, food, water, air, or even supplements, often without being aware of it. And exposure can occur through ingestion, inhalation, or skin contact over long periods of time. Heavy metals such as lead, mercury, and arsenic are well-established causes of neuropathy, and exposure may occur through contaminated water, poorly regulated supplements, industrial settings, or older buildings, while certain industrial chemicals, solvents, pesticides, and herbicides have also been linked to nerve damage, particularly with chronic or repeated exposure. Occupational exposure is especially important in people who work in factories, agriculture, chemical handling, or similar industries, as well as in individuals with past military exposure to toxic substances, and in some cases, nerve damage from toxins can be long-lasting or even permanent, making prevention and early recognition critical. Because nerve damage is often difficult to reverse once it becomes severe, prevention is far more effective than treatment, and once neuropathy progresses, available treatments often focus only on reducing pain rather than repairing the underlying nerve injury, which may never fully heal. For this reason, it is important to regularly review medications with a healthcare provider, minimize unnecessary drug use when possible, avoid known toxin exposure, follow safety protocols at work, use protective equipment, choose reputable and tested supplements, and support overall metabolic and nutritional health. Healthy nerves depend on adequate blood flow, balanced vitamins and minerals, antioxidant protection, and physical activity, and general lifestyle measures that support nerve health include regular exercise, a balanced diet, avoiding smoking, limiting alcohol intake, maintaining healthy blood sugar levels, and reducing exposure to environmental toxins whenever possible. And while certain supplements and nutritional strategies are often discussed in relation to nerve health, these should always be approached carefully and discussed with a qualified professional to avoid unintended harm. In conclusion, neuropathy is not always just diabetes, and medications and toxins can trigger nerve damage, worsen existing symptoms, and slow recovery. And understanding these risk factors allows individuals to ask better questions, seek more thorough evaluations, and focus on prevention rather than only managing pain after damage has already occurred. And if you found this information helpful, consider sharing it with someone who may benefit. Thank you for watching, and we will see you in the next video.